Artificial Intelligence Doctor www.abcpharma.net/English. User question. If typically, Aveir VR pacing is expected to produce a relatively narrow QRS, is a wider QRS of 200 ms. Duration in a leadless pacemaker set at 50 beats per minute, an indication of suboptimal lead placement? Claude AI answer. A QRS duration of 200 milliseconds in a patient with an Aveir VR leadless pacemaker set at 50 beats per minute is indeed concerning and could be indicative of suboptimal lead placement, though it's not the only possible explanation. Let's analyze this situation. 1. Expected QRS duration. Typically, Aveir VR pacing aims for a QRS duration less than 140,150 milliseconds. A 200 milliseconds QRS is significantly wider than expected and warrants investigation. 2. Suboptimal lead placement. This is a strong possibility and one of the primary considerations. The device may be positioned away from the ideal septal location, possibly closer to the RV apex or free wall. 3. Other potential factors. Underlying conduction disease, myocardial scarring or cardiomyopathy. Fusion beats, especially likely at 50 bpm. High pacing output settings. Metabolic disturbances, e.g., severe electrolyte imbalances. 4. Significance of 50 bpm setting. At this lower rate, there's an increased chance of fusion beats with intrinsic rhythm. Fusion can sometimes result in wider QRS complexes. 5. Evaluation steps. Compare with immediate post-implant ECGs. Device interrogation. Chest imaging to confirm device position. Echocardiography. Consider electrophysiology study if needed. 6. Implications. Wide QRS complexes can lead to less efficient ventricular contraction. Potential risk for heart failure symptoms or pacing-induced cardiomyopathy. While suboptimal lead placement is a strong possibility, it's crucial to conduct a thorough evaluation before reaching this conclusion. The low pacing rate adds complexity to the interpretation. A comprehensive assessment, including device interrogation, imaging, and potentially an electrophysiology study, would be necessary to determine the exact cause and guide management decisions. Would you like me to elaborate on any specific aspect of this analysis or discuss potential next steps in evaluating this patient?